Hey, everybody, it's David Kemp, host of Highway to Health podcast series. Glad to have you here today. You know, in the past, we've talked a lot about the challenges that our providers are facing and how that leads to challenges that our patients experience and the challenges that lead to poor health outcomes for our communities. Today, we'll talk to the Chief Growth Officer, Kevin Sleeper of ABAX Health, where he'll share some insights on how providers and healthcare systems can shore up some revenue leakage and maintain patient community and getting those referrals in the door a little bit more often, which provides greater cash flow for the system, but also better health outcomes for the patients. And Kevin, welcome to Highway to Health. I'm glad you're here.
Thanks for having me. I appreciate it.
How's everything going over there?
It's going good. It's cold up in chilly Vermont, but you know, that's the way we live. So no complaints overall, but all good. Just got off Thanksgiving. Hope you and your family had a great Thanksgiving.
Yeah, we did. I hope you did too. You look like you got a good no shave November going as well.
Yeah, I contemplated going or at least shaving the mustache, but then I saw yours and I just decided there's no way I'm going to compete. So I kept the beard going just to provide some variety to our context or our conversation today.
Well, it's pretty bad on this end, but hey, it's November 30th, so tomorrow I'll be a brand new man, and I'm looking forward to it. I know my family is too. But hey, we'll get into work here in a minute. But before we get started, I always like to talk about the healthy habits you've built up in your life. It's so important for us to stay healthy mentally and physically, and I know you've built up some good habits over the years. Tell us how you do it. How do you stay mentally prepared, mentally healthy, and then maintain your physical health as well?
The mental part's pretty straightforward. I have 4 kids, which I think you do too, actually. I have 4 daughters that my youngest is 8. I've got 1 in high school and 2 in college. So I think the mental sharpness is a requirement to maintain sanity, but they're fantastic and they keep me on my toes. And I think physically too, besides them, I've got a 3-year-old chocolate lab that I happily go run with because he's slow and lazy and he keeps up right about the same pace I do. But just do what we can. It's a little bit easier now. We're not on the road as much, but when you used to be on the road all the time, it was a little bit more challenging. But try to keep consistent and just do what we can, eating right and keeping things good with our family.
Man, whenever we were traveling, for those listening, Kevin and I used to work together, and when we were traveling, we were in a new hotel every week and eating all the food that you probably shouldn't be eating, and maybe even drinking some of the drinks that you shouldn't be drinking too. And it's hard to keep up with your health. One good thing from the pandemic is it has slowed down that travel schedule. We're getting back to it now, but being at home more often means you get to work out a little bit more. You eat at home a little more often, and
your body starts to feel a little bit better.
Yeah. Well, tell us about ABAX Health and your role there, and give us an overview of ABAX, and then we'll dive into, this referral challenge that we're starting to see across many providers.
Yeah. So I lead growth at ABAX Health. So we are at our core, we're a clinical analytics and patient communication, patient engagement company. So the essence of what we provide, we've identified with our technology ways to leverage a health system or healthcare organization's clinical data. We take that data into our technology. Our data engineers, the smart people, do a bunch of stuff with it that I don't fully understand. But what we ultimately come out with on the back end is a way to identify a patient population, a group of patients that have had an order or a referral, but haven't been seen for that. And there's a lot of things we can chat about that I think result from those situations. But we identify that patient population, we quantify it. So, how many of those patients are there by department, by procedure, and what does that mean from a revenue opportunity standpoint for your organization? And then lastly, we've built a world-class concierge patient access team so that perform all of the patient access functions to go out and engage that patient, educate them on why they need to be seen, and help them navigate their way back into the health system. So to actually get that visit scheduled.
You mentioned, revenue leakage, and what we've seen this year is in terms of revenue leakage and providers really facing challenges with cash flow and margins. And I mean, there's no other way to put it. Keeping the doors open, that challenge has been at a scale this year and in recent years. It's been a bigger challenge than it has been in the past. Let's start at a high level. When you say revenue leakage, let's make sure everybody that's listening understands exactly what you're talking about, because there's a million reasons why providers are having these challenges right now. But let's understand exactly what you mean by revenue leakage first, and then we'll get into the details.
Yeah, I think it's a good question. And to your point, there's a lot of reasons why people are struggling financially. But when it comes to revenue leakage, and people refer to as patient leakage or referral leakage, well, you think of a patient that comes to be seen. I'll use myself as an example. I go see my primary care doc. He's part of a large health system locally. I walk out the door. He says, "Hey, Kevin, you're over 45. You need a colonoscopy. I'm going to refer you to somebody to go be seen for that." I walk out the door and I never come back. That's the leakage we're talking about. A patient that you could get scheduled back into your health system for a follow-up visit, walks out your front door, and you're never seen again. And there's, as I mentioned before, there's a lot of issues, both from a revenue standpoint and from a patient safety, patient health standpoint, that result from those things.
Yeah, I mean, that story is pretty relatable. I have, in my family, I have a history of skin cancer, right? So I go see a dermatologist all the time. Even something as serious as that, if the onus is put on me as the patient, as soon as I walk out that door, you and I have a million other things that we're shuffling. You have 4 kids, I have 4 kids. We have work, we have all these other things that we're focused on. We oftentimes put ourselves last in that category. And so, the provider that we were referred to get that next follow-up or that next service of care, that next provider, that next appointment almost needs to be taken care of for us, or in some ways, us guided to that next appointment, to that next visit, so that we maintain our health in the way that we need to stay healthier longer and have a higher quality of life.
Yeah, I think you're spot on. And, we see, I'd say a handful, maybe a little bit less than that, of reasons why people don't get that follow-up visit. The first one that we talk about is fear. You get the colonoscopy referral and you're like, "Oh crap, I'm going to find something worse than I expect. I don't want to know that," which I've done and is silly as you think about it. Finances, which is a big issue for a lot of patients. I mean, there's situations across the US where patients will skip their healthcare visit in order to pay their rent, which is just something that shouldn't happen. And there are ways to address it, but patients need help with that. You pointed out time. We've got a crazy schedule. We've got kids, we travel, you name it. And then the last one you talked about at a high level as well is confusion. You and I have been in healthcare for 20 years. I know how to read an EOB. I know how to navigate a scheduling appointment, things like that. There are people like my mom, my dad, other folks that don't understand a lot of the process and just need help. They need to get on the phone with somebody that can help them figure out how to get that scheduled. And that's part of what we're here to do.
Yeah, I think the confusion piece is important. Not only helping them understand where they can go that's within network, helping them find a time that's convenient for everybody involved, but also, why they need to care. And sometimes I think that's most important. And you touched on it just now. It's, what could happen if you don't go see this, this doctor I'm referring you to, if you don't go get the services that I'm referring or recommending for you. That education piece for the patient on, look, there's 2 paths here. One is, let's get this taken care of. The other path is, if you don't, this is what is likely or has a high percentage of happening in your life. I think that education piece for the patient is just as important.
Yeah, we agree 100%. That's part of the reason we were pretty focused on making sure we had a live services team that could get on the phone with patients. And the primary intent is that education piece. Why do you need to be seen? Why are they recommending this visit? People just don't understand it. They don't understand that some of these visits can prevent long-term health issues if you catch them early. And they just need a little nudge in the right direction is the way to think about it.
So after that education piece has happened, there's the logistics, right? Where you've got to point them in the right direction to to a provider that's in network, that, their insurance will be accepted, to lower their cost. You got to get on the calendar. You got to get the schedule. Tell us how important that piece of this is, and how ABAX has seen some success in getting patients back into the door more effectively.
Yeah. So, I mean, the engagement piece is huge. I heard a statistic probably a couple of weeks ago. I was listening to another podcast, and they were saying that during the pandemic, patients' preference for communication, it was about a third, and a third. So email, text, and phone. And I think that was great at the time. And now it's shifted to a point where 2/3 of patients are saying, we just want somebody to pick up the phone and talk to us. So that's a massive change. And you and I get, 1,000 text messages a day. It's overwhelming. So the automation certainly helps, but the ability to get on the phone, and then to your point, there's scheduling, there's registration, there's insurance verification, there's authorizations in a number of situations. There's now no surprise billing. How do you figure out how to get through that entire process? We have a team, patient access experts, folks that have been in the industry for years that we've hired that specifically focus on nothing else but doing that. So once they've educated the patient, then help them get through all of those steps to the point where they're actually scheduled directly back into the healthcare's application.
I was speaking to the head of research over at Notable recently, Carly Falk, who, anybody listening, she's a rock star. And what you're talking about right now is at the core of one of the biggest challenges in healthcare. When we as consumers work in any other industry, if there's a recommended next step, with your bank, even with, the car lot that you're purchasing a car, if there's a recommended next step, that next step most of the time is taken care of for you. In healthcare, we're still working towards that end goal. But the expectation of the consumer that they've become accustomed to in every other industry, that expectation is what they have in healthcare. When they walk out of that primary care office or that clinic, and the referral's been made and the recommendations been made, in a lot of instances, they're just assuming that next step is going to be taken care of, and they're going to hear when and where they need to show up.
Yeah, and it's not, and it's unfortunate. And we're trying to get there, right? Like, I think we all recognize that we need to get better, but you're right. We live in a world of Amazon. You buy something, 2 seconds later, you Google search, and there's an ad popped up for the next thing that you might want as a result of that. So we need to get there, and we will get there. I heard apologize if I mess up his title, but I believe he's the chief marketing officer and digital experience officer at Honor Health. I was listening to him on a podcast a couple of months ago. And he said, we really need to start thinking about things differently. And he referred to the fact that patients really aren't patients till they're sitting on your exam room table. They're consumers. And we're now more than ever in a scenario where these consumers have options, especially with Walmart and Amazon and CVS getting into the mix here, who will step up the digital experience game. So we really need to think through how we can change this process for our patients, how we can make it better for them. And some of these patients, the referrals could be 7 or 8 different visits. Imagine the complexity of getting a note that says, hey, go schedule 7 visits with these, options for physicians, and figure out the time and take care of it yourself. And oh, by the way, make sure you get us a copy of those records back so we can take a look at them at some point or another. I mean, that is very confusing to a lot of folks, and something that we need to help them with.
And it has to be consistent. I mean, you and I are in sales. If we were to send one email, one text, or one phone call and expect the outcome to be what we wanted,
That'd be nirvana.
for the action to actually happen, we wouldn't be very successful. So your follow-up, your engagement, your education to that patient has to be consistent. It has to be accurate, and it has to happen often. And that's hard, because now you're talking about in the old traditional way of engaging a patient, that usually took a person on the provider side to say, hey, don't forget, hey, you've got an appointment, here's where you need to go. But in the reality of nowadays in healthcare, we don't have the people to make that consistent type of engagement and that consistent type of connection with the patient to educate them on where they need to go and when they need to be there. So how I'm assuming that's got to be a challenge for our providers. It's probably a challenge for ABEX on how to consistently educate and engage that patient to make sure that they take the action that you're recommending.
Yeah, I do. Well, I mean, the staffing shortages, not just within healthcare, but across probably the entire world right now, at least throughout the US. So we're seeing that in health systems. We're talking to folks and they need help. They have, 17 different priorities they're working on. And simply, they just don't have the staff to manage a lot of this. So, and, we that's part of why we're here. We're stepping in to help folks manage that. We're stepping in with our resources to support their needs. And help drive some of that communication, and then really be as consistent as possible throughout that process.
When we talk about leakage, I mean, we could have people from really every piece of the healthcare system, and they could articulate where they're experiencing revenue leakage within their system. I think of the revenue cycle back end. You're talking about denials, you're talking about rejections, you're talking about underpayments. You're talking about all these different ways that revenue is falling off the table, right? It's slipping through our fingers. So how big of a pie, or how big of a piece of the pie is this referral leakage when you're talking to a provider? What are you seeing at a national level of, look, this is, if we can shore up this part of your process, how much of a revenue impact could you make typically on a provider, for a provider?
Yeah, I think, the industry average that we see is 30%. I read an article probably a week ago that said, they interviewed, I can't remember the number of CEOs, but there was a third said 10% they estimate of their revenue is leakage. Another third said 20. Another third said, I don't know, but it's probably greater than 30. So if you use the 20% number and you look at $1 billion health system, that is a lot of money. It's gross revenue, obviously, but if you start to boil that down, and let's say it is 100 million, you capture 50% of that, you're not looking at 50 million. That is a lot of money that can drive a lot of good to a healthcare organization, whether it's hiring new staff, new physicians, new nurses, whether it's, potentially building a facility. You think of some of the rural communities that we see as we travel across the country, and you've got a pregnant mom that's going to drive an hour just to be seen by their physician, which is got to imagine what that does to her day with potentially other kids or work or a number of different things. If you do capture that revenue and all of a sudden you've got a new facility that's now 10 minutes away, the benefits that provides to your community is immeasurable.
You said it perfectly. We're one of those families. We live an hour outside of town. There's a few rural hospitals, critical access hospitals out by us. But you want to talk about the demographic of providers that's being hit the hardest with this revenue leakage and keeping their doors open and keeping certain service lines available. They're the ones that are being hit the hardest. And so, we have a 2-year-old daughter, and when we were going through that pregnancy process, the checkups, the labor and delivery, the follow-ups, it was an hour drive into town to see the nearest provider that provided the resources, the services that my wife and my kids needed. That puts tremendous strain on families, and those that don't have the means. Now you're talking about true impact, negative impact to that population's health and their well-being.
Yeah, and you think just about the patient that doesn't have a ride from their front door to the physician office. That is a huge issue. They need help figuring out, how can I get transportation in that situation? To your point, it's not only the time constraint for you and your family, but probably the stress for you and your wife. If she's pregnant and you're just sitting there thinking, oh crap, what if something were to go wrong? God forbid, but the things happen. And you've got an hour drive to see somebody. So those are things that really need to be addressed on a broad scale.
So you're talking about big money here. I mean, $50 million for $1 billion provider.
And don't quote me on that ROI, but yeah, directionally.
No. Yeah, directionally and on average and all those terms. Yeah, don't quote anybody on that because it's different for everybody. We know that in healthcare,
Yeah.
nobody's the same. But
No, yeah, it is big numbers. I mean, you could say millions, and if you look across the entire healthcare industry, you could argue it's in the billions. How much of that can you capture is to be determined. And some organizations, to be fair, do it really well. They manage their leakage, they manage their patient population really well. But there's a lot that don't, and it goes back to the resources, the time, the priorities of what other projects they have got going on. So there's a lot of things that need to be addressed.
you touched on something earlier in our conversation that, I see more and more, when we work with companies or, in our personal lives outside of healthcare, there's this growing prioritization around creating fans of brands because that drives loyalty, it drives repeat business, right? So, whoever your favorite brand is, let's say Yeti does a great job of making a fan out of me, and I'll pay a premium, right, for a Yeti cooler or Yeti tumbler because I'm that big of a fan of the brand. You're starting to see that work its way into healthcare a little bit. You talked about consumerism and how they're not a patient until they're in your exam room, right? Until they're sitting on the table. How does this help create fans for different healthcare systems to drive patient loyalty and then even patient acquisition?
So I think it's a good point. It takes a village, first of all. It's going to take everybody that's part of the health system to contribute and help make your patients a fan. But I do think it's important. One of the things we talk about internally at ABAX, and the reason we very specifically named our services team a concierge services team, is to provide that additional level of support to patients before they're seen for their visit. So to make sure that our clients, lack of a better term, is seen as the health system that cares for them. So somebody that's proactively engaging them, making sure their patients understand why they need to come in and actually getting them back in the door.
Yeah. I mean, I think a healthcare system or any business they can have a dual focus. They've got to keep their doors open to provide the care and the services that are necessary. So they have to be revenue and business minded, but to get there, they have to have that patient focus.
Yeah, I think, the thing that's important to understand is you can focus on driving revenue, and the impact on patient health and patient safety is directly correlated. So there's nothing wrong with bringing more revenue into a healthcare organization, focusing on that, because it brings so many positive things to not only your staff, but your patients. And ultimately that drives improved patient satisfaction, that improves their healthcare long-term. So there's a lot of upside to everything that we're doing.
And it makes total sense. I've been I was in revenue cycle about 8 years and mainly focused on the back end, like we talked about earlier with, claims and claims management and then denial management, contract management. Obviously there's a lot of opportunity in the patient access at the front end, but what we're talking about today, this referral leakage, it's almost the silent, I don't want to use the term killer, but for the lack of a better term, it's kind of this unspoken area of revenue leakage that may not get enough focus, may not get enough attention. When you're talking about 30% of revenue leakage for a provider on average, if we could shore it up, it would make an incredible impact for our industry.
Yeah, there's no question. 100% agree.
And if you think about, I always go back to your personal experience. If you think about any other industry, it would be silly for, your car dealership to say, "Hey, we've got the car ready for you and you can come pick it up at this time." And then you never show up to pick up the car. They're never going to get the payments. And so they don't let it happen in those other industries. And that's where healthcare is starting to focus now is making sure that those patients do walk through the door. They are educated and engaged, and they understand the two paths, the path of getting it done, having a higher quality of life, maintaining a lower cost of care, and then the opposite path of, look, this could have serious impact on your family, on your life, and the longevity of the quality of life you're living.
Yeah, I agree. And, we haven't even gone down the path of value-based care, but that's a whole nother area that needs to continue to drive and be focused on across the industry. I know a lot of people are, but just as valuable as the revenue and the fee-for-service side is, there's a whole lot of value around this on the value-based care side as well.
I would imagine, and obviously value-based care is kind of this enigma that continues to evolve, and who knows how it is applied at scale. But I would imagine this would only become more important when value-based care becomes more of the system of choice.
Yeah, it is 100%. I mean, you think about driving the patient back into the healthcare system for an appointment, which drives revenue. Value-based care almost flips the switch on this, and it says, hey, we want to make sure that patient doesn't come see us very frequently because we want to keep them as healthy as possible. So let's make sure we're engaging them on a frequent basis, getting them in for the preventative treatments that they need. And ultimately, that's going to lead to longer-term health. They're not going to come see us as often, which is great.
Yeah, and education will only become more and more important with value-based care. Patients are going to have to take responsibility of certain things away from the hospital setting, away from the clinical setting. They're going to have to maintain a certain level of awareness and accountability of their health to make that value-based care system effective.
They are, but they're going to need support to do it, right?
Yeah.
Folks like us, folks like you, and much broader community to help them do that.
I agree. If there's one thing, maybe we've already talked about it and you want to reiterate, but if there's one thing that you want our listeners to take away from our conversation today, what would that be?
I think, we talked a little bit about it in regards to making patients a fan already, but, our thought process is we want people to think differently about finding revenue or revenue generation. And what I mean by that is you talk about the back end, so the denials and the claims management and all those components. Those are visits that have been billed. Those are revenue that's at least on the books right now that people are going out to collect. This is revenue that's sitting on the clinical books, we call it, but has never been actually realized. And if you think about a health system like a Best Buy or a Costco or a grocery store is a great example. They purposely stick the milk in the back left corner because they know my kid's going to grab 17 things out of the cart. And instead of spending 50, I'm going to spend 100. Now, I don't say that in the context that I, want to go see my primary care doc and just swing by the cardiologist for fun and rack up a bill, for lack of a better description. But the point of that is those organizations, a grocery store, Costco, think of same store sales. This is revenue that's sitting on clinical books that nobody's doing anything about. The cool part is that we've built a technology to identify it. We can present our findings, show exactly what's out there. And then we've got a whole team of folks that can go track it down and try to drive as many of those patients back into the health system. It will drive revenue. But once again, all of those things benefit the patient long term. It starts to improve their overall impression of the health system. It starts to improve their actual physical health. And ultimately, they're more satisfied long term.
Yeah, and access to health, right? Because if the systems are getting what they need by retaining these patients and getting them back in the door when they need to be there, then more doors will stay open, more service lines will be available, and access to care will improve.
Yeah, 100% agree.
It seems like low-hanging fruit, and I know it's not as easy as it sounds, and I don't want to diminish it in any way, but it's on the books already, like you said, to use your term, and it seems like an attainable way for providers and healthcare systems to start realizing the revenue that they need. Yeah,
you're right. It's not easy, but it is out there, and it's something that we can go find and health systems can go find. And I don't want to diminish the hard work that our operations teams and health system operations team have to do to actually go out and talk to these patients and get them back in the door. But there is a lot of opportunities sitting out there for organizations to pursue. And once again, we've talked about it over and over again, but there are so many benefits, offshoots from what this comes from. I just think it's something that people need to stop ignoring and pay attention to.
Well, like you said, it's going to take a village, and providers can't do it all on their own. Patients can't either. And so it's going to take strategic partnerships with companies like ABAX and others to bridge those gaps and make sure that village comes together and collaborates to provide a better patient experience, better patient outcomes, while keeping the doors open of the providers that we need so dearly. So, Kevin, thank you for being on Highway to Health. Thank you for educating me and others about the opportunity that's out there for our systems. And good luck to you guys.
Thanks. Good luck to you. Really appreciate it. Good luck shaving the mustache. I know it's gone tomorrow. So.
Same to you, man. Talk to you soon.
All right, bud. Have a great day.